To the podcast. I'm Dr. Lori Marbus, and I'm so honored to have Dr. Joel Fuhrman with us today. How are you, sir?
Doing great. Excited to be here and talk to you.
Wonderful. Well, we have two cases from the journal that we want to discuss with you today. The first one is efficacy of a plant-based anti-inflammatory diet as monotherapy in psoriasis. And so I think, there is some confusion as to some people maybe what psoriasis is. Could you give us a little background and just explaining what psoriasis is?
Yes, there's more than 100 different autoimmune diseases where your own immune system is attacking your body in some way. And it's related to a degree of heightened inflammation. An autoimmune disease where you attack your skin and develop skin plaques is called psoriasis, but it can be associated with a disease like rheumatoid arthritis. When you have joint pain plus the skin disease, then it's usually called psoriatic arthritis. In this case we're discussing, this person did have joint pain and psoriasis, so she really had psoriatic arthritis, and she also had Sjogren's syndrome, which is another autoimmune disease that gives you dry mouth and dry eyes and other symptoms. She almost had a lupus-type syndrome. Lupus and rheumatoid arthritis and ulcerative colitis and multiple sclerosis are also common autoimmune diseases. And I'm suggesting that in my 30 years of practice, I've had very rewarding and remarkable successes in all those cases with multiple sclerosis, with lupus, with ulcerative colitis, with rheumatoid arthritis, with psoriasis, and with psoriatic arthritis, inducing complete remissions where people did not have to be sick and have those diseases the rest of their life. And we're using this psoriasis case of psoriatic arthritis case as an example, because most of my 30 years as a busy family physician seeing these people, I didn't keep contact and continue to keep the information to be able to want to write these up and write them up as cases, but I've kept in contact with some of these people, and here's a person that I know now because I think she came to me in 2005 or 2006, so this is about 15 years later, and it was a remarkable case because she was so ill, and she could hardly move in bed for so long, taking drugs for her psoriatic arthritis, and had such a limited life. And then when that year when she got well and got rid of her psoriasis and her psoriatic arthritis completely, she played volleyball, she played tennis, she climbed mountains. She went away to one of her getaways at the Red Mountain Spa, and she put her arms up in the air and said, "Look at me, I'm a miracle." And I said, "You're not a miracle. This is just what nutritional excellence can do for people, that these are inflammatory conditions. And it seems like a miracle because the conventional medical approach is to give people chemotherapeutic agents to suppress the immune system instead of excellent nutrition to remove the inflammation and to allow the body to resolve these conditions." And I'm excited to be part and to contribute some of these cases to the journal because I really feel that we can definitely, if people they're suffering greatly and they're not being told that there's an option for them to get well here.
Right, absolutely.